Hello friends, welcome to Creative Medicine. In this lecture, we will learn about one more important thing is it decreases the occurrence of atrial fibrillation and thus results in safe decrease in HbA1c. Nitrates are used in all of the following except nitrates are used in congestive heart failure, cyanide poisoning, esophageal spasm also. It is not used in renal colic. They can be used in biliary colic, not in renal colic. So uses of nitrates are congestive heart failure, angina pectoris, myocardial infarction, biliary colic, diffuse esophageal spasm and cyanide toxicity. Nitroglycerin causes all except nitroglycerin. Okay, nitroglycerin causes methemoglobinemia because it is a nitrate drug. It causes hypotension and tachycardia and vasodilatation. It does not cause bradycardia because nitroglycerin causes vasodilatation and thus it causes decreases blood pressure and thus reflexly it increases the heart rate by sympathetic activation. Thank you and thank you for watching.